We get a headache, we take a pain reliever. When we have a high fever, we will go see the doctor. When anything feels off physically, we tend to jump right on it. But when it comes to our mental and emotional health, we tell ourselves to shake it off, to tough it out, and to keep going. So, why is it that so many Americans still hesitate to treat their mental health with the same care as their physical well being? Today, Raphael Wald, Doctor of Psychology at Marcus Neuroscience Institute, a division of Baptist Health, is here to share his expert advice as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
I'm Julie Donaldson, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. We have Dr. Wald with us today and a great topic. We're looking forward to this show, Dr. Wald.
Very happy to be here. Thanks for having me.
All right, let's get straight to it and kick things off with a question from Paulette, who reached out to us through our website, allhealthtv.com. Paulette's question is, Dr. Wald, my husband Shane works for a company that's had a couple of layoffs since the beginning of the year. Now, I've begun to notice that the fear of losing his job, well, it's beginning to take its toll on him. How can I help Shane without pushing him away? Dr. Wald, this is such a relevant question these days. How can we best help our loved ones in these situations?
Yeah, that's a really good question. A lot of times with human behavior, it's very difficult to know what exactly the right answer is. So when we're talking about an infection, there is an evidence-based way to treat it with a certain antibiotic. But unfortunately, when it comes to feelings of guilt or shame or grieving, there's really not one right answer. And a lot of times we can give the wrong answer and it turns out very, very poorly. And many times there might be 1,000 wrong answers and only one right answer, or there might be 1,000 wrong answers and no right answer. Sometimes the best thing to do is to just not say anything at all. Really, what we're trying to do in order to have the best approach to this is to sort of prognosticate, to sort of predict. You know your partner, you know the person that you're speaking to, and you say to yourself, if I have this conversation with them, how do I think this is going to go? If I had to bet $100 and I had the following conversation with them, knowing them, do I think it would have a positive outcome? Sometimes the answer is yes, sometimes the answer is no. Do I think that this person needs to just kind of be left alone to kind of process things in their own mind and that's how they would do best? That's also very, very frequently the right way to go. We're just going to try to predict as best we can what we think would happen and go with our gut on that. And you can't be guaranteed that things are going to turn out perfectly the way that you want them, but hopefully, on the basis of a strong relationship, the person knows that it's all coming from the right place.
And it is definitely difficult to navigate with the climate that we're in. So it's such a relevant question right now. We have a lot to get to. So let's keep going on here. And heads up, docs, we've got a YouTube question now from Carlos. He says, Hola, Dr. Wald. My twin brother Hector was recently diagnosed with prostate cancer, and it's been really hard. And I'm not just worried about him, I'm also worried about myself since we are twins. Now, as such, I've been feeling this constant unease, and I'm not sure if it is anxiety or if it's stress. Now, is there a difference between the two? It's a really great question from Carlos, Dr. Wald, and I've always kind of thought they might be the same thing, but is that the case?
Yeah, that's a really good question. So, stress is an appropriate reaction to difficulties in your life. So, if a person has a stressful day at work because they got a bunch of work piled on their desk, an appropriate reaction would be to say, okay, I've got all this to do, and I'm going to get just anxious enough, just upset enough in order to make sure that I manage it, manage my time properly, and I get everything done. It's not a great feeling, but it's an appropriate response to a stress. Anxiety, by definition, means that you're reacting more dramatically to something than you need to given the circumstances. So, an example that I like to use is, let's say you have a boss who is well known for just popping off and yelling at everybody the second they walk through the door, which is a terrible circumstance to be in, but unfortunately, a lot of people are in that situation. If they do that every day with everyone around the office, and then, you come in one day and they yell at you the same as they do every other day, and you spend the day hiding under your desk because you're worried you're going to get fired, even though it's happened 1,000 times before, that's an anxiety response, right? So the way that you're reacting to something is in excess of what the situation warrants. So that's really the question you need to ask yourself is you need to take a step back and look at the situation and say, am I worried? Am I stressed just the right amount, given that it seems like there may be some kind of a genetic link to prostate cancer? Or am I worrying too much given the circumstances? Meaning, well, hey, wait a second. So I've been to see my urologist, I've been checked, I've had all the tests necessary that have been asked of me, and my doctor is telling me right now that I don't have prostate cancer and that my risk is very low. If you're still getting extremely stressed out about it, that's probably in excess. And the goal of most treatments for anxiety is to kind of crack your thinking back in line with reality. So you're thinking too dramatically, right? And we're just trying to get you in line with reality again.
And that can be so hard to do. What would you say are some of the quick symptoms, maybe, of anxiety to decipher between the two?
So anxiety can pop up in a lot of different forms. It's a very complicated construct. So anxiety can come in the form of just general worry. So you spend your day worrying and you can't stop thinking. Sometimes people have panic attacks where they have an increased heart rate. They might feel nauseous. They feel like the walls are closing in. Generally speaking, when people have anxiety in their lives, insomnia is very common. Some people might have unexplained back pain or muscle pain. You might feel tired a lot of the time. Loss of appetite is a common issue in a number of different psychological problems. So, anxiety can creep up in a lot of different ways, including with sort of general worry, feelings of panic. Um, Obsessive compulsive disorder used to be considered an anxiety disorder, but certainly is adjacent and similar to symptoms of anxiety. So it can be different for everyone, but these are a lot of symptoms of anxiety that are common across multiple anxiety related issues.
I think it's so good to be able to recognize some of these symptoms so you know how to treat it and how to best be able to go about the issue that you are facing to help you through that, whether it's with a loved one or yourself as well. We have another question here, and this comes from our website, allhealthtv.com. If you've never visited, well, you should go really check it out. We have lots of great information for you. And this question, it comes from Kimco, who asked Dr. Wald, with all the school and workplace shootings that have happened over the past few years, well, my kids are occasionally afraid to go to school, and I sometimes worry about my husband going to work. How can schools and the workplaces better prioritize mental health? Dr. Wald, we hate getting this question, but so many people have a fear of this. What can we do?
Right. That's a really good question. And it's actually a question I get asked a lot. What I want to underline here is asking yourself that question again is, am I responding this in an appropriate way? So, imagine if you're watching this situation on TV, you're watching a person who is, thinking about school shootings and thinking about mass shootings. Are they responding to it, objectively, as almost as if it's this other person? Are they responding to it in a way that you'd expect them to, given the circumstances? And if we're going to get really scientific about it, how many people are living in this country? Over 300 million. And how many of those people have experienced or have lived through a mass shooting or have had someone very, very close to them live through a mass shooting? Thankfully, as crazy as it sounds, only a teeny percentage of people have ever lived through a mass shooting in this country. So remembering that statistically the probability of that happening is extremely low. But with that being said, you do want to be concerned enough about it that you're looking into things. You're looking at the school your child is going to and saying, what precautions is my school taking in order to prevent that? Do they have a plan for locking down? Do they have sufficient security on campus? Again, we just compared stress to anxiety. Let's do it again, right? So, am I having a stress response where I'm saying to myself, statistically, the chances of this are extremely low. so I'm not going to lose my mind about it, but I am going to check on it. I am going to talk to the school and ask them, what are we doing in terms of safety precautions in order to manage this? Um, I really want to underline that. I'm glad that we had that question earlier, which compared stress to anxiety. Am I responding with an appropriate stress response, or am I responding with anxiety? We're always trying to have a proper stress response. And what's really, really important is knowing that very frequently you're not going to be able to do that properly. A lot of times you're going to have an anxious response when you should have a stress response. It happens to a huge number of people in society, and don't get mad at yourself about it. It happens. Everybody messes up with things, and you just try to do it a little bit better, 1% better than you have been doing it.
This is something that unfortunately we see, I think, all too often. Is it also important in the situation as she's dealing with herself to have this conversation with your children or your family members should a situation like that arise, or is it best just to try to temper it with yourself?
Absolutely, yeah, definitely. So, I think it depends on the severity of the issue, but it's a really good question. A lot of times with mental health, there's not one right answer to that question. Um, if the problem gets very severe, then certainly I think it's something that you need to involve loved ones in. If it's something that's really interfering in your daily life, um, we've discarded a lot of what Sigmund Freud has said as, being kind of crazy and out there. But some of the things that he has said really still stand out and still make sense. So what he said is the goal of a well-adjusted person is to be able to love and work, right? Makes sense. To be able to love, if you're able to love and you're able to work, you're in pretty good
Mhm.
shape.
I
Is
think
my
that's a good
anxiety I'm sorry, go ahead.
No, I think that's a really great thing to remember as these fears do come up, to keep that love aspect within the days that we go about, right?
Yeah, definitely. And
Okay.
it are if we're not able to love and work properly because of anxiety, then that's probably a point at which you should involve your family for support and start looking into seeing a mental health professional.
Okay, absolutely great advice. We now, a lot of people have questions. They want to know where they can submit them, doctor. So, in case you missed it for the first time, here's another opportunity to find out where to send in your questions to the doctors.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
And again, so many questions coming in here on this topic. Our next one, it comes from Facebook. Alexi would like to know, my parents came here from Russia many years ago and have never been big proponents of psychiatry or psychology. What are some common myths or misconceptions about mental health that you hear? Now, Doc, I know a lot of people feel a little bit uncomfortable with the thought of going to somebody that mental or emotional health. So what is the response and answer to that?
Huh, it's interesting. So I want to be honest. Obviously, I don't know your parents, and they probably, been through all kinds of different difficult experiences in their lifetime. But what might surprise some people that I want to say is that as people get older, you don't need a doctorate to know this. They tend to get more fixed in their ways of thinking and are a little bit less willing to kind of bend their understanding of the world. Um, that's the case also with people's acceptance of mental health. There are some people that might not ever believe in getting mental health. We want to try to help people understand the value of it, and that's a huge job that every psychologist in the world has, is trying to help everybody understand the value of it and help them understand that mental health problems can be treated. But unfortunately, there are some people that just might never get there. And what I want to stress to our question asker is that you need to take care of yourself. Um, if you feel like you need to seek help, you should seek help. And I think that that is something that your family hopefully will come to understand at some point. But if not, you really do need to take care of yourself and you need to seek care for yourself. And hopefully, at some point, the people around you will come to know that it does have a huge value.
And hopefully, with you taking care of yourself, they will see the work that that does and become more accepting and understanding of it as well. Our next question, it comes from Shoshana. Shalom, Dr. Wald. My sister's husband lost his job last year, and their Cobra, well, it just ran out. Now, they're both obviously going through a tough time at the moment. If someone can't afford therapy or doesn't have insurance, well, what are some practical ways to start taking care of their mental health right now? Well, doctor, we know insurance is so expensive, but it shouldn't limit somebody from being able to get the help that they need.
Awesome, man, great question, and I'm so glad you asked it. It's funny, I was in the doctor's lounge here at Baptist Health and was talking to a couple of other doctors that I work with, different specialties, neurologists and other specialties. And I don't know why it popped into my head, but I looked around the table and I said, I wish the one idea that we could get out to all of our patients, whether they're neurological disorders or they're orthopedic issues or any other kind of issues, is understanding the value of having a 30-minute walk 5 days a week.
Mm.
It is healing for everything, almost everything, assuming that your heart and your body are healthy enough to do so. Um, there's a lot of research, and it's been repeated over time, that shows that if you do get some kind of exercise, and especially cardiovascular exercise, it doesn't have to be crazy intense cardiovascular exercise. You just want to elevate your heart rate a little bit, like going for a brisk walk. It is just as effective as antidepressants if you stick with it. And believe it or not, people are less prone to relapse if they stick with it than they would be if they just counted on the antidepressant. So the number one thing, and that's for your cognitive health, your medical and physical health, and your psychological health, is to get 30 minutes of exercise 5 days a week. If you're in too much pain or for some other reason you're unable to walk, try to find it some other way. You can get in a pool and move around or walk back and forth or do whatever you can, or do chair yoga for 30 minutes 5 days a week. There is nothing that you can do for your psychological health, I think, that probably is better than that. On top of which, research has shown over and over again that eating a healthy diet is crucial to mental health. People that eat healthier diets are less prone to anxiety and depression. And what I mean by that is eating a lot of vegetables, fruits, the fresher the better, eating a lot of unprocessed foods, the less processed the better. And what I mean when I say that, just really to be clear about what processed food is how similar does this thing look to what it looked like when it was pulled out of the earth, right? So if you take, you know, a potato chip where all of them are in the exact same shape, or you take a cookie where all of them are in the exact same shape, they don't even remotely resemble whatever it was that they looked like when you took all those ingredients out of the earth. So that's highly, highly processed. The less processed, the better, and the better it is for your mental health. So, number one, two, three, four, and five, I would say exercise. After that, it's diet and socializing. Keep people around you. The old saying that misery loves company is absolutely true. Isolating yourself is not going to be for the best. So keep yourself moving, exercise, diet, socialize, and try to keep doing the things that you know that you enjoy when you are feeling well. Even if they don't feel right, the more you can keep yourself doing them, the sooner they will feel right.
Absolutely love this answer. And it seems so simple to get fresh air, to move your body, to eat that makes your body feel good. But I know for a lot of people, especially if they're not feeling well, it can be really challenging. But it's good to have that advice, to know that we can control a little bit more than maybe we sometimes think in these situations. So thank you for that, knowing that it's very difficult to navigate. Now, our next question, it comes from Priya, and she wants to know, greetings, Dr. Wald. It seems like my wife has been having head and body aches all the time recently. Now, her father passed away a few months back, so I'm sure she's still depressed. I'd like to know how mental health impacts physical health, and why is it important to treat them as equally important? Doctor, you just touched on this, but let's get into just how important it is for our physical and our mental to work together.
Yeah, absolutely. I mean, I want you to think of it this way. Your brain controls everything in your body. If you don't have a brain, your heart doesn't beat, your blood doesn't flow, you have no voluntary or involuntary movement, everything shuts down. That's the circuitry that makes everything move in your body, right? And it's the same brain that we use for all those processes: thinking, acting, eating, anything else, and the involuntary stuff like digesting food. It's the same brain that also I don't want to say causes, but is involved in mental health problems like depression and anxiety, right? So depression and anxiety have an effect on your brain. If you look at different kinds of images called PET images that show how hard your brain is working and how hard different parts of your brain are working, you'll see that when people are depressed or severely anxious, their brains are not working as hard as they are when they're feeling well psychologically, right? Your brain functions differently when you are depressed or anxious. So when your brain's not functioning properly, everything else falls apart. Remember, we said the brain controls everything. So if your brain's not working right, everything's affected. Your digestive system is affected. Your circulatory system is affected. Your muscular system is affected, which is why we feel pain. It changes the general chemical and hormonal makeup of your body when a person is depressed and anxious. So without mental health, it's so difficult to have
Mhm.
physical health. Um, that's why I think it's crucial that people see them as being equally important, because it's really almost impossible to have physical health without mental health.
I guess we're all connected in our bodies, physically and mentally. We have a little video to kind of help out with this next question, and it comes from YouTube, and it comes from Carter, who asks, "Dr. Wald, I've been pretty irritable lately, and it seems like every little thing it sets me off: traffic, commercials, and every time I hear AI being referenced. My wife thinks I might be depressed, but if I was depressed, wouldn't I be sad all the time instead of angry?" Now, doctor, this can be kind of confusing because depression, you tend to think that, it is sadness, but can it come in the form of anger?
Sure, absolutely. And I know you mentioned that there was a video that you wanted to show that might help with this. So uh, if we're going to go into it now, we can definitely do that, or I can provide my answer to that.
Let's
Um,
go to, well, why don't we go to the video?
sure, absolutely.
Hi, I'm Dr. Craig Sawchuk, and I'm here to talk with you about depression. Approximately 1 in 6 people will experience a major depressive episode at some point in their lifetime, while up to 16 million adults each year suffer from clinical depression. There are many types of symptoms that make up depression. Emotionally, you may feel sad or down or irritable or even apathetic. Physically, the body really slows down. You feel tired, your sleep is often disrupted, it's really hard to get yourself motivated. Your thinking also changes. It can just be hard to concentrate, your thoughts tend to be much more negative, and even in some cases have thoughts of not wanting to live. Behaviorally, you just want to pull back and withdraw from others, activities, and day-to-day responsibilities. Help is available. You don't have to deal with depression by yourself. Take the next step and reach out.
Hey, doc, there you go.
Yeah, so that's a really good video. In order to link the video to what Carter is asking, what I want to point out is that depression has a number of different symptoms. So depressed mood, which really just kind of means you're not happy. Anhedonia, which means you have a hard time enjoying things that you normally would enjoy. Feeling guilty about things that aren't your fault. Changes in your appetite, changes in your sleep, problems concentrating. So depending on the person, depression might look very, very different from one person to another. For some people, depression is being in bed and not being able to get out of bed because you're feeling so depressed. For other people, it looks like extreme irritability and lashing out at other people around them. Again, irritability is one of those symptoms of depression. So depending on who you are and what your life experiences are and what your chemical and physiological makeup are, you might have depression that looks one way, but it looks absolutely nothing like another person who also suffers from depression. It might look like anger in one person and sadness in another. It might just look like a complete absence of any feeling whatsoever in some people. So just depending from person to person, it's really hard to say that you really wouldn't say that it looks the same in everybody. So, Carter, to answer your question, is it certainly not unusual for a person to have feelings of irritability and to have that be sort of the lead symptom of anxiety that is most noticeable to you or people around you.
Think a lot of it, doctor, goes to this whole conversation, just what those symptoms were, to recognize them within your lives of what you're dealing with, what your loved ones are dealing with, and then trying to find the best approach. But what I loved most through all this is how you said the brain is also connected to the body and how important it is to take care of our physical health, to help with our mental health. But if you do have mental challenges, to make sure that you go and you seek help. Now, that is all the time we have for today. Thanks so much for joining us, Doc. I'm Julie Donaldson. We'll see you next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.